Welcome back. Hope you enjoyed your break. Got your coffee, whatever else you needed. Now that we've talked historically about influenzas, we want to talk some about vaccinations. There are two types of vaccines that we use to help fight the flu. One is the flu shot. That's inactivated. It contains killed flu virus. Dead, irradiated, done. We get that via a shot, IM injection in the deltoid muscle. The other choice is a flu mist. It's a nasal spray, kind of like the nasal atomizer that we can use for Narcan. Similar to that, like an Afrin spray. That, however, has a live attenuated vaccine. So it's a weakened form of the vaccine that is given, and it has to be that because it's just not as effective if you were to have the dead, killed vaccine. So two different options here, IM injection or nasal spray. I'm not sure which one I personally prefer. I think that in some cases, people who are needle phobic but who want to have the flu vaccine, it's a good option for them. How do flu vaccines get made? Well, each year, the CDC, the World Health Organization, goes back to what they think is going to be the H and the N prevalent for this year. They are able to extract that RNA, identify it, and then start developing vaccines on it. Problem with this is that it's somewhat, I don't want to say a crapshoot, but it's an educated guess as to what is going to be coming. They usually get it pretty well right, but it's always a caveat to think that maybe this is not what's going to pop up, and we're seeing that this year with this year's H1N1. So the World Health Organization, along with CDC and all of these organizations worldwide, make this determination, publish information, and each country then decides how they want to do their vaccines, what they want to produce, and when vaccinations are going to occur. So since the 1970s, pharmaceutical companies have been producing flu vaccines. As you can see, it takes about 6 months to do that. They inject the flu virus into chicken eggs. It takes 6 months to incubate that, develop that. So that this year, when we talk about H1N1, that came up in February, March, April, we were already well into production for the flu vaccine that's coming out this fall. Thankfully, technology is advancing so that it looks like the flu vaccine is going to be able to produce 2 different vaccination options, and that's what's going to be recommended. What's going to be recommended is the traditional flu vaccine that they had identified back in February as what the target was, and then with the H1N1 that just came up, there's going to be a second vaccination option that's really going to be encouraged to move forward. It's going to be a 2-step shot. So those of you who are opting for your flu vaccine, just be prepared. And when you go to participate in a flu clinic, be aware that you may well be administering the previously identified flu strain and then 2 shots for the new H1N1. There's medical personnel there with you. There should be some kind of medical oversight there. And if you're at all in doubt, refer the people sitting there waiting to get them the vaccine to the people running the clinic. We talked already about the common side effects and how people think, oh, I had the flu shot once, I got the flu, I was sick as a dog, I'm never getting it again. Remember, the flu shot is killed virus, not really going to give you the flu. It's your immune system that responded to that made you feel crummy. So you didn't get the flu from the flu shot. Just kind of want to make sure that people understand that. Common side effects, I feel achy, it hurt at the site, I had a little bit of stuffy nose, I didn't feel good for a couple of days. With the nasal spray, a little bit greater possibility, because remember, this is not a killed virus, but an attenuated, weakened virus. Again, the same kind of side effects people are going to get. Stuffy nose, sore throat, achy. Obviously, they're not going to have pain at the shot because there's no shot. Unpleasant side effects, yes, but when you compare it to the actual flu, what the flu can do for you personally, what the flu can do if you pass it on to your loved ones or to people who you are taking care of, and the death rate, especially for the elderly, the young, you decide what's good and what's not good. So what's the dose here? There you go, 0.5 ml, half a cc, IM, the deltoid muscle, right up here. A 1 to 1.5 inch needle, look at the body type of the person you're going to be giving the shot to. You've got your 300-pounder who's got a huge beefy arm, that person's going to need a 1.5 inch long needle. You've got your little old lady who weighs maybe 80 pounds soaking wet and has got a tiny little arm. Maybe even a 1 inch might be a little long. A 5/8 might be the right choice. You're only going to have a 1 inch there. Just modulate how deep you go in. I like, personally, the 25 gauge needle. It's small, and I'm just amazed when I use that people say to me, oh man, I didn't feel that at all. There's no need to use a whopping big needle here. Pneumonia, let's talk about this a little bit. Pneumococcal pneumonia. Originally, as you saw from our historical perspective, that was a big player in causing death. People got that. Streptococcus pneumonia is common. It lives in our nose. It's everywhere. It doesn't cause a problem as long as it keeps itself where it belongs, in our nose. It's when people have a weakened immune system that pneumococcus pneumonia and that streptococcus pneumonia says, hey, let me move on down. I see greener pastures down there in the lungs. It's warm, it's moist, there's bacteria in there. Life is sweeter for me down there. That streptococcus pneumonia migrates down, causes a full-blown pneumonia. In the elderly, deadly. Long-term hospitalization, maybe having to be put on a ventilator, not good outcome. This is different from pneumococcal pneumonia. We're talking about the secondary bacterial infection that comes after the virus. So this has no vaccination for this. This is streptococcus pneumonia. Again, not a good thing. What's happened in the most recent, I would say, 10 to 20 years? We've seen all pneumonias become very adept at changing their stripes again, as you will. Penicillin in the past killed all of these pneumonias. It was a wonder drug, right? I mean, when penicillin came out, it was the wonder drug. But what's happened as we had used penicillin over and over again and all the other cillins, pneumonias are now resistant to that. So here's the concern about getting the flu with your secondary streptococcus pneumonia infection. We don't have such good tools anymore to fight that secondary infection. We're kind of painting ourselves in a corner. Now you have people coming back for repeated vancomycin every single day. Think of the cost, think of the inconvenience, the time lost. Not so good. Is an ounce of prevention worth a pound of cure?